Hello everyone, I am Dr. Ashwin Tamhankar. I am a consultant in Uro-Oncology and Robotic Surgery at Apollo Hospitals, Navi Mumbai. Greetings from Apollo Hospital. The title for today's talk is Why Men After the Age of 50s Should Come to See a Urologist. So I am trying to give a broader overview of this particular topic. Let's find out about what all symptoms or what all are the burning issues of gentlemen after certain age of 40s or 50s. So first comes under this roof is lower urinary tract symptoms, which is also called as LUTS, which is a group of symptoms which can manifest in terms of having increased frequency in the urination, increased nighttime urination, also called as nocturia, or urgency in the urination, or sometimes people may have urgency followed by leakage of the urine called as incontinence. That's why why individuals after the certain particular age would manifest with these symptoms. The reason being, prostate generally grows in size with the age. Every gentleman is bound to have increase in the prostatic size after certain age. There is no fixed mathematics or correlation with the size and the symptoms, but whenever you have any symptoms which are alarmingly troubling you, you should come forward to get yourself evaluated. Second symptom under this umbrella is blood in the urine. It can either be seen to the naked eye, also called as macroscopic hematuria, or it cannot be seen to the naked eye and can be seen only under the microscope, called as microscopic hematuria. Either of these is not a very good sign to have, and even the first episode of blood in the urine should not be neglected at all, and it should be reported to the urologist as soon as possible. The third thing which I wanted to talk to you about, prostatic enlargement and prostate cancer. So after certain age, like I said, prostate is supposed to grow in size. Only question is whether it will affect your life or affect your quality of life or not. But if it is affecting in terms of having urinary issues, you should report to us. Generally, prostate cancer, I'll come to that later, but prostatic enlargements are supposed to happen because of the hormone-dependent events in the body after certain age, and they would need to be addressed if you're having trouble. At least someone needs to be started on some medicines, and further down the line, if you're unhappy on the medicines, you may require some kind of intervention for that. So let's come to prostate cancer. So prostate cancer is a burning issue, to be honest. It's the second most common cancer across the globe. Nearly 1.3 million people get diagnosed with prostate cancer every year, and nearly 3.5 lakh people succumb to this every year. It's in Indian situation, somehow it is not that commonly reported, but obviously we are not lacking behind in the numbers. The prostate cancer generally happens or arises on the background enlargement of the prostate. So what is the importance of screening? Basically, screening is a simple test which is applicable for certain cancers, in which we try and evaluate a group of healthy individuals and rule out cancers based on some simple tests which have good sensitivity. Simultaneously, those tests should not be too costly so as to utilize resources carefully. So prostate is one of those cancers which is picked up on the screening. What are the screening tests? These are twofold. One is a simple test on blood called prostate specific antigen, or a PSA test, and a second test is examination by a urologist for examination of the prostate to feel for the abnormality in the prostate. Any of the abnormalities on these particular two tests would further percolate into further cycle of diagnosis or for ruling out prostate cancer by doing some MRI or some biopsy of the prostate. But the screening program somehow in Indian situation or Indian context is not that robust. These days, last few years, all the insurance companies have started allocating this particular test as a part of their insurance policies, or screening policies, but we need to be vigilant whether we have this test got done or not. Simultaneously, along with that, like I said, a urologist should examine an individual as well. What all are the age cutoffs? If we actually see the guidelines, European guidelines would say after the age of 50s, one should have these two tests done once a year, and American guidelines would say after the age of 55, you should have these particular tests done once a year. So in translating that into the Indian situation, after the 50s, you should have these particular two tests done to rule out prostate cancers. Why it is important? Because if we detect it in an early stage because of these screening modalities, there is a significant reduction in the mortality to the tune of nearly 1/5 or 20% reduction in the mortality, and nearly 30% reduction in the cancer getting detected in a very late stage. So we have distinct advantage of getting these particular things detected early. It actually correlates with any cancer biology. Any cancer would be indolent in the particular organ for some time or for few years, and then slowly it would come out, and hence it is important for us to pick it up early when it is actually indolent into that particular organ, so as to have good opportunity for us to cure the individual. The last thing which I want to talk to about is erectile dysfunction. Somehow we have a stigma in Indian context. These because of some social inhibitions, we are not very open for discussing about the sexuality, but after the age of 50s, many of the individuals will have problems related to erectile problems. They have diminishing erections. Why it is not, why this particular symptom can't be ignored? Because it doesn't only correlate with the sexuality, because obviously sexuality is one important aspect, but second important thing which I would want to tell today is penile attack, we call it in medical terms, always precedes cardiac attack, by which I mean whenever there is a sign of erectile dysfunction, that means the process of blockage in the vessels have already begun in your body, and you need to be vigilant so as to avoid any subsequent problems for your cardiac vessels getting blocked. That's why you shouldn't be ignoring these symptoms. Report it to the concerned urologist, and he would guide you further for getting evaluated for your heart as well as management of the sexuality. So just quickly to sum up things, beyond 50, lower urinary tract symptoms are going to happen for everyone. How troubled you are would translate into the treatment plan or evaluation protocols. Prostate cancer is a burning issue. Screening has to happen after the age of 50s, once a year. Couple of tests which are simple tests, which the results of which are available within 4 to 5 hours, which would give adequate opportunity for us to pick up cancers early. And erectile dysfunction, which may happen after a certain age, shouldn't be neglected at all and should be reported as soon as possible for a happy and healthy life. Thank you so much.